Hi, I'm Rob, and I'm a recovering doctor.
Hi, Rob.
No. That wasn't very good. Let's try it again. Hi, I'm Rob, and I'm a recovering doctor. Much better. On September 28, 2012, after 18 years in a private primary care practice, I walked out of the door into a new life. I stopped being paid by insurance companies. That was 5 years, 4 months, and 6 days ago. Not that I'm counting. It was not easy to leave. We doctors had developed quite a dependency on insurance money. And as is often the case in dysfunctional relationships, familiar suffering is often a lot less scary than change, even if that change is for the better. But I was ready to burn out. I was unhappy. I was depressed. I love being a doctor, and I feel like I'm gifted at it. But I was ready to quit. And unfortunately, I am not alone. Doctors are reporting burnout and leaving medicine at increasing and alarming rates. A 2014 study found that 1 in 4 doctors planned on leaving their practice in the next 2 years. And just last year, 51% of physicians surveyed said that they were feeling burned out. Now, why is this? Why would a doctor who loved medicine and loved his patients be ready to quit? Well, it's not taking care of patients that's the problem. It's the system that makes doctors want to leave. It does so in 2 ways. First, it floods us with busy work, taking our eyes off of our patients. For doctors in normal practices, much of the time is spent following insurance company rules, dealing with unruly computerized medical records, and submitting data to the government and to insurance companies. Less than half of the time the doctor spends is spent with patients, and that is simply not enough. Before I left, I was going home each day feeling depressed, like I was not able to give good care to any of my patients. But the bigger reason for doctors' dissatisfaction and burnout is the system itself, which has perverse financial incentives. Now, if you're a patient in a normal practice, your doctor is financially rewarded to do the following: to force you to come in for all care, no matter how little the problem, for you to be as sick as possible, because the sicker you are, the more insurance pays. To do as many procedures on you as possible, such as injections or lab tests. And finally, to spend as little time with you as possible. Nobody wants this. It's terrible for patients, but it's also terrible for doctors. I was forced to choose. Do I do what's good for my business, or do I do what's best for my patients? Do I sacrifice money for my children's college fund, or do I sacrifice time with the depressed patient or the diabetic? It's a lousy choice, and it's a choice that I had to make all day, every day. So, on September 28th, 2012, my sobriety date, I left. I looked at a number of options, but my best choice was a practice model called Direct Primary Care. This model has 2 central differences. First is that doctors are paid directly by the patients, not by insurance companies. And the second is that instead of paying for office visits, the patient pays a monthly fee, generally less than $100. My patients pay between $35 and $65, depending on their age. I believe that these 2 changes in how the doctor is paid are the key to giving better care, cutting costs, and radically improving the experience for both doctors and patients. Having patients pay the doctor directly increases the value of the care the patient gets. The idea of value is something that's foreign to most of the healthcare system. It's not normal for somebody to shop around for the best deals on doctors or lab tests or colonoscopies. But doctors paid by patients are motivated to keep things as inexpensive as possible, because people who save money are more likely to stay. The practice grows if it's willing to go the extra mile to save the patient's money. This isn't done out of generosity or self-sacrifice. It's simply good business. And there are lots of ways to save money, such as finding the lowest cost on medications, whether by searching for the best pharmacy price or, as we do, by selling drugs directly out of our practice at wholesale prices. Lab costs can be cut by 80% or more simply by negotiating prices with the lab companies. And finally, there are significantly less expensive places to get x-rays, MRI scans, colonoscopies, and other procedures. You just need to know where to look. Patients paying also improves the customer service. Now, healthcare is notoriously bad at customer service, but doctors who are paid by patients are motivated to give the best experience possible, again, because those patients are more likely to stay. Direct primary care practices can improve the patient experience in many ways, like using communication tools like secure text messaging or video chat to improve access from outside the office. Using online tools to track blood pressure, diabetes, and other chronic problems on a daily basis. And by bringing care to the patient directly by doing house calls. And this is me with my very first 2 patients on the first day of my practice in their home. Now, this probably sounds wonderful to the patients out there, which is everybody. But the doctors are probably getting a little nervous. I mean, how can this be done in a way that is still profitable? That's where the monthly payment comes in. When a doctor is paid by the month, they're no longer rewarded for having a full office. This means that doctors don't need you to be sick all the time, and they don't have to bring you in for every little problem. Normal doctors lose revenue when they give care by the phone or via text message, but the monthly fee makes it so care can be given in whatever way is convenient, since the doctor's paid the same regardless of how the care is given. Office visits are fine, but I've found that less than a quarter of the patients coming into my old practice actually needed an office visit for that care. So, in direct primary care, if you have a rash, you can just take a picture of it, send it via text message to your doctor, and get it taken care of that way. Or let's say you're vomiting and have a fever, clearly a virus, you're just staying home from work, but your work requires a work excuse. Well, you can send a text message or call your doctor's office, and as long as it's reasonable, they can just give you your work excuse. Nobody benefits from pointless office visits. And because most of the care is done via phone or text message, the office schedule is rarely full. I saw only 15 patients on the busiest day over the past 5 years. And my normal days are between 8 and 10 patients, which is about a third of the volume in my old practice. When doctors first adopt direct primary care, and I did too, you have to resist the urge to freak out when the office is empty. Because in truth, I'm paid just as much when the office is empty as when it's full. The stress level is so much less. And an empty office benefits the patients as well, because people almost never have to wait to be seen in the office. A 2 o'clock appointment can be seen at, get this, 2 o'clock. Patients can almost always get same-day appointments, too. No more waiting 2 days or 2 weeks or 2 months to be seen. And finally, the doc can spend much more time with each patient. I give new patients between 30 and 60 minutes of face-to-face time with me, and my routine visits are generally scheduled for 30 minutes. So you see how the system is better. It just makes sense. It's better for patients, but it's also much better for the doctors. Well, here are some real-life examples. Joe is a 52-year-old who has been my patient for many years. He was at home, and he noticed a lump in his neck, and he was worried about it, so he sent me a message. I messaged him back and said, "Come on in." When I examined him, I too was worried about this lump in his neck, so I sent him to a specialist who, unfortunately, diagnosed Joe with cancer. But we had caught it early. Now, after he was treated and in remission, he told me that he would never have come in so soon in my old office. There was way too much hassle. So he would have waited maybe too long to be seen. Susan is a 48-year-old who messaged me on the weekend saying that she had been out running and she stepped in a ditch and hurt her foot. She was worried that it might be broken and wondered if she needed to go to the emergency room. I told her not to bother, that she could just come in on Monday and I'd check her. We ordered an x-ray, which only cost $40, by the way. And it was in fact fractured, but the fracture was in a place that the orthopedic surgeon would have just put a boot on it for 6 weeks and let it heal. So that's what we did without the orthopedist. Sorry, orthopedist. Now, after everything was said and done, I thought about the fact that she had fractured her foot with fairly minor trauma, especially for a 48-year-old who was athletic. So I ordered a bone density test, which showed that she had osteoporosis, thinning bones, which we've been treating ever since. Two central changes in how doctors get paid, and the cost can go down, the quality can go up, and the overall experience can be much better. Doctors and patients can be partners, not adversaries. And it has worked. I've been open for 5 years. I have over 700 patients. I have a small office staff, so my overhead is kept low. I've never been happier. My nurses have never been happier. And my patients are delighted with the care that they get from us. And I feel like I've never given better quality health care to my patients. Plus, my income is approaching that which I had when I left my old practice. And direct primary care is growing. When I started 5 years ago, there were about 100 or so practices in the United States. Now there's nearly 1,000. Doctors who make this change are often criticized for being selfish, for doctoring for wealthy people, and that this approach will be the downfall of American medicine. Well, obviously I disagree. Most of our patients are working class, many don't have insurance, and a significant percentage of them are elderly. As to the downfall of American medicine, how is giving better and more cost-effective care a bad thing? The real question is, why don't more doctors do this? And how can we figure out a way to make this generalized to the whole system, to all primary care doctors? Imagine how much money, how much hassle, and how many lives that could save. So, with all the depressing news about our system, be encouraged. There are new ideas out there. There are ways that we can radically change our system for the better. And those changes don't have to come from politicians or bureaucrats. The best changes come from the people who those changes affect the most. I believe that people don't agitate for better health care because they don't realize that the quality of care they're getting isn't all that good. And the reason they don't realize the quality of their care isn't good is because they don't realize how good it could be. So to the doctors and medical students out there, I say, there is hope. You can love medicine again. You can partner with your patients, and you can enjoy them as people. If I did it, you can do it. And to the rest of you, I ask you to do one thing. Expect more from your doctor. Thank you.